Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and it's my pleasure to be with you today. As we have been mentioning now for months, the best healthcare system model in the world is the aspirational healthcare model, superior outcomes at half the cost. South Central Foundation's NUCA system of care in Alaska is the best example of this model. They are the only healthcare system that has won the President's Malcolm Baldrige Award twice, once in 2011 and again in 2017. Countries come from all over the world to go to Alaska to learn how the NUCA system of care can be so much better than all the other systems, half the cost with far better outcomes. Wouldn't it be nice if we could all purchase healthcare from South Central Foundation's NUCA system of care? Well, we can't. However, we can take a close look at how they manage healthcare and apply similar models to the healthcare benefits we purchase for our employees. The foundation of the NUCA system of care is a massively powerful primary care system. As we have interviewed numerous people who are a part of the NUCA system and are members and receive care through that system, and we ask, why is it so special and what do you like about it? They always reply with, I know my primary care doctor and my doctor's team, and they know me. I know that they're always there, just a phone call away. I can get all the health care I need through them, and they will coordinate all my care. They genuinely care about me and my health. That's what the people who are part of the NUCA system always say. So as employers, how can we offer that kind of health care to our own employees to attract and retain top talent? Well, all employers can offer this model of primary care, which is often referred to as direct primary care, by simply building it into our benefit strategy. Today, we're going to discuss this direct primary care model of care, and I'm honored to have with me as my guest today, Dr. Vicki Samuels with ImagineMD. Dr. Samuels, thank you so much for being with us today, and would you take a few minutes to introduce yourself and ImagineMD to our attendees?
Thank you for inviting me. My name is Dr. Samuels, Vicki Samuels, and I'm part of ImagineMD. We are a small practice in the West Loop of Chicago. We actually have two offices now. We have one in the West Loop of Chicago and one in Bloomingdale, Illinois. We're still growing, and thankfully, we are growing because people understand that direct primary care is an excellent an excellent way to get better care. I was in solo practice for about 10 years, and then my practice was bought by a large organization. I worked for that organization for a few years, and then I met the founders of this practice, Dr. Alex Lickerman and Rhea Campbell, and we met and discussed our goals in caring for patients, and we knew that we meshed. So I left that big practice and decided to join them, and it was the best choice I've made. So I've been with ImagineMD for about 3 years, and it's been great for me as a physician, and I believe great for my patients as well. It's direct primary care is going to be the next way to care for patients, and I'm sure we're going to go over that a little bit more in the next
Yeah,
few
I believe that
minutes.
too. Talk a little bit about why it's so much better. Why do you like it as a physician? Why is it so much more enjoyable for you to be in this kind of a model versus the traditional model?
Well, we always have a lot of patients when we're in a traditional model. In order to make it, really, we have these things called RVUs and relative value units, and that is how we don't say, hey, this is the patient. We're more about how many RVUs can you get to make sure that you earn income, honestly. And that's not why I became a doctor, and most people did not become doctors for RVUs. We became doctors to take care of people. And what changed was that RVUs became the way things were driven more so than great patient care and making sure that you got to relate and to know your patients. So when I joined ImagineMD, it went back to what I thought medicine should be. It went back to, hey, you know what? When Jane comes in, I know Jane. It's not, I met Jane once and she's got 5 problems, but how can I make sure that I go over these 5 things with her? Or I usually didn't have enough time to go over 5 things. Now, if she's got 1 thing or 20, we have time to talk about them and we can review them together. We make plans together. And I think that's how medicine should be. And direct primary care allows that. Now, of course, traditional medicine, there are fabulous doctors in traditional medicine. But I think we all feel we're rushed. And that's gone out of, we no longer have to deal with that in our practice now. We now have time to talk to them. If we don't, I mean, we always have time for them, but if we need to review something, we have the time to say, hey, you know what? I'm going to get back to you in a few hours. Let me go research this. Let me go get some evidence to say this is why this treatment is best. And that wasn't always there when I was in traditional fee-for-service medicine. We had some time, and the easiest thing to do was, well, take this medicine, let me refer you to someone, and then I'll get back to you in a few months. That doesn't happen anymore. Now I can say, hey, I'll get back to you tomorrow if I need to, or we can address it today as best we can. But if I need to do some research, I have the time I need to do that research. And patients know that and appreciate that. Now, everybody's not a difficult patient, meaning they don't have these um, I mean, everybody doesn't have these things that need a lot of research, but if I need it, I can do it. And I can I can collaborate with my partner here, Dr. Lickerman, and also reach out to some specialists if I need to. We have the time to build relationships. And I think that's what has gone away from traditional fee-for-service medicine. The relationships aren't there. And now I have that opportunity to do so.
So talk a little bit about how direct primary care does get paid, because you're not billing insurance anymore. Talk a little bit about the subscription model.
So we no longer worry about copays. That doesn't happen. We are a monthly fee, and so we charge a certain amount per month, and the patient just has to pay that each month. It is less than a phone bill, a cell phone bill. And I haven't met a person who doesn't have a cell phone in the last 6 years, 10 years even. And most people who say, I need my cell phone. I think more importantly, you need your health. And so we say, hey, if we tell them you pay your phone bill every month, this is almost like a phone bill and probably more important. So it allows us to not ever worry about, I need to get them in here 4 times to make sure I get 4 copays. Copays are never discussed. We don't have to worry about it. It is one fee once a month, and that's it. And they can come see me once a month if they want. If they want to see me once a year, it is what is appropriate. And where we feel that they need to be seen more often, we can. But there's no value in saying, hey, I need to see her 15 times just so I can, get these visits and these RVUs. Now we're about, if I need to see her 15 times, it's because 15 times is the appropriate treatment plan, and we can make sure we discuss everything that is going on with her health, or his or her health, and to address all those issues. So
Well,
it's just easier.
and it's aligned with the patient. In other words,
Yes.
your goal is to keep that person as healthy as possible, because the more unhealthy you are, the more work you got to do. So you've got an alignment with the patient. They're aligned with you because they're paying you to keep them healthy in the first place. And now let's talk about employers. This is a wonderful model for employers to incorporate into their benefit strategy, because again, now you've got the primary care doctor, which is the foundation of healthcare, aligned with the employer. The employer wants their employees healthy. The doctor wants the employees healthy, and everybody's working towards keeping them healthy in the first place. Where traditional fee-for-service, where you're buying a health insurance plan, a traditional plan, you're paying a premium, the doctors, the insurance plans, the providers, the pharmaceutical companies, everybody gets paid based on RVUs or fee-for-service. So the more that people fall off the cliff, the more money the system makes. It's like, wait, there's something wrong with this. This isn't how it's supposed to work. There's supposed to be, if the buyer, the employer, wants to attract and retain top talent, they don't want costs to be enormous, they want healthy employees, then why not create a system that's working for those same goals instead of paying for a system that's misaligned or perversely aligned? And what I like to tell business leaders is, look, your traditional approach to buying benefits for your employees is you put all your money into one basket. Let's buy an insurance plan. And sometimes I'll say, look, I'll buy this, but you can choose between 2 or 3. And I say, well, no, you're the buyer. You buy to get what you want. You put different buckets in place. So put a bucket of money into that, a traditional catastrophic plan, but set another bucket of money aside for a different kind of primary care. And say to your employees, look, if you'll go pick a direct primary care physician who now is aligned with you, I will give you $100 a month or $50 a month, or maybe they split it some way. But now it's like, if you'll go get the foundation of healthcare that will keep you healthy, I'll pay for it. Now, if you go, no, I'm just going to use my traditional plan, then fine. I'm not going to make you use a direct primary care physician, but you don't get the $100. The only way you get the $100 is to actually build it into your overall plan and to say, I want to have it, and I go get it. Now, I tell my employees, if I'm going to spend $100 on you to have a subscription model for direct primary care, you need to, as a minimum, go see your doctor at least once a year for a good, thorough physical, so you can talk about how you're going to keep healthy. You know, the whole idea of direct primary care is you now have time. In fact, talk a little bit about what you do when you have a new member. I love the fact that you spend an enormous amount of time with each new person, and you try to do that in person so you can really build rapport. Talk a little bit about how you do that.
So our first appointments are scheduled for 2 hours. Now, every patient does not take 2 hours, but we never want a patient to come in and say, I didn't have enough time with my doctor. And some patients are 13, some patients are 99. So, but a 99-year-old still may not have a lot of issues, but they've lived 99 years. So they've got a lot of things to discuss and say, hey, this happened to me when I was 15, this happened to me when I was 45, and those things can be discussed. Our goal is to say, if you want to talk about it, we have the time to talk about it. And most patients say, I don't think I need 2 hours. That sounds like way too much time. You'd be surprised. More often than not, we go the full 2 hours because we don't just talk about, hey, what medications are you on? But we talk about their family history. We talk about their own personal history. We talk about mental health issues. All those things we have the time to do, and we make sure that if they have concerns, we go through them. If they've done their own research, we say, hey, where did you research that? Were you using Google? And has that been your source of medical information for the last few years? Or is something else happening? But we have time to evaluate and really get into the depths of their health and say, this is how we can make sure that we've addressed your concerns, how we can make you healthier, and how we're going to make a plan going forward. I think sometimes there's no plan going forward. How are we going to work together to make sure that they are on board and can I think we've been disconnected somehow, but I'm hoping that we're still talking.
You hear me?
I can hear you, but okay.
So keep going. We may have just lost the video.
Okay, there you are. Okay, there you are. But it really is about making sure that if a patient has concern, that we are able to address it. And most patients, I just still have patients that really do only need 45 minutes. They're like, I'm healthy, I want to stay that way. How can we get there? And we make a plan for that. But if they have more medical issues that need a little bit more time, there is no 15-minute window. Like, let me talk about 15 issues in 15 minutes. It just can't be done. Medicine really doesn't work that way, and healthcare shouldn't work that way. It is about making sure we get to the root of the problem if we can. I mean, we don't cure everybody that comes through our doors, but we attempt to make sure, can we make the best plan for their health? And I think that's what's changed here with ImagineMD. It is that much better in terms of just establishing a plan, really, to say, how can we care for you and how can you care for yourself when you go home from this appointment today? And so 2 hours, it does sound like a lot. And when I first started, I'm like, 2 hours, and the time flies, honestly, because you get to know the person and the patient gets to know you. They get to know your style of care. And I think sometimes that's where people want to come in, like, I want to meet my doctor. Like, you don't just get to meet me. We talk about what your goals are. When we talk about goals and the goals of the patient and what I think I can do to achieve those goals with them.
Well, and I'm so glad you brought that, because that's so critical that healthcare be built around the person, their values, their journey. They are the owner of their own health. In fact, if you look at the entire healthcare spectrum, only about 25% is what the healthcare system does to us. 75% of our health is based on what we do and the way we live our lives and every aspect of our health and well-being. And so our healthcare system generally puts 100% of its time and focus on the 25% of what the person's health represents. Well, what the NUCA system did was they said, well, what if we build a healthcare system where 75% of our time was focused on keeping the person healthy? And it's amazing what you can do with overall population health when the healthcare system is balanced to meet the customer's needs, instead of the customer just simply coming to be the benefactor of the institution of medicine after people fall off the cliff. And
Right.
when you talk about meeting with them for 2 hours and finding out their goals, it's a lot more than just physical health, isn't it? It's emotional, it's social, it's nutritional, it's environmental. Everything goes into making up our health. And I love the fact that direct primary care doesn't limit it to what's the problem today? You know, how can I
Yes.
fix the problem today?
Our goal is to make sure we know you, the person, the patient, and to make sure that we address all of those things. And because our health is not one thing, it doesn't is not one system. Our bodies are a whole bunch of systems, and we need to make sure how they work together and how we can make them work best. And that's what our goal is. So, but you had mentioned earlier today about cost, and I think one of the things that we've seen with employers is that they've gone, a lot of times patients will use emergency room as their primary care. That doesn't happen with direct primary care. We make sure that if some patient it has an urgent matter, we talk about it that day. Hey, are you thinking about going to emergency room? Can we handle it in our office? And if we can, we do. If they do need, emergency room is for emergencies, and if they need to go, we will make sure. But most times, I would say more often than not, we can avoid an emergency room visit, which of course is one of the most expensive type of visits that you can have. And first of all, we know the patient. We know that they, what kind of care they've received in the past, what kind of care they need going forward. So most patients don't want to go and sit in the emergency room for 4 hours anyway. We say, hey, we can schedule you today. We can take care of this issue and let's move forward. But so not only emergency room visits, we avoid urgent care visits. Both of them are costly, and but it's still better with us because we know the patient and we know their history and we know where they've been and where they're going.
Well, and talk a little bit about the fact that once you meet with the patient for an extended period of time face to face the first time, and you really get to know them, a lot of your care can be offered over the phone.
Yes. So
And how
one
do
of
you,
the
how do you make that available to people? Do you give them your cell phone and say, hey, call me if you need me?
So we have direct lines. So one is my phone line that we call, if a patient just says, I need to talk to Dr. Samuels, my phone number it goes directly to my office number. And now when I'm in with a patient, they can leave me a voicemail. But if they have an emergency, it actually rings to my medical assistant and he will come and knock on the door and get me out of the office because emergencies trump everything. And if they need to talk to me right then, they say, hey, I just don't know what to do. I have an emergency. He knocks on the door and says, and we say, excuse me, the current patient, but we would want that to happen for you if you need it to. And there is no layers. There are no 5 layers here. The biggest layer is my medical assistant just coming to have to knock on the door to come get me. But at night, they do have direct access to my cell phone. And that's 24/7. So, during the office hours, my cell phone's here, but my medical assistant kind of answers the phone for me. But
Right.
after 5 or our regular hours, it rings to my cell phone. And so if they need it to talk to me at 2 o'clock in the morning, it happens. And we say it's not to say hi, it's for emergencies. But most times they don't want to use it. But we will say, if you are thinking that this is something urgent, it's better to call me. Let's get this handled. And they love that. And most patients will say, oh, it's one of the best aspects. They can't believe that I answer the phone.
Yeah.
Like, that's who you should talk to. I know you better than anybody else, hopefully, other than your spouse or whoever else, but as far as your healthcare is concerned, I should know you best, and I can help you, and we can make a decision together. Is what's the next best step? Is it to go to the emergency room, or can you wait to see me the next day? And if they can, they're like, oh, you can get me in the next morning, absolutely, because we want you cared for, and they appreciate it. And it's been one of the things that is used by a few patients. I mean, all patients have access to it, but sometimes they feel like, no, I shouldn't do this. But no, it's offered to you, and when they have to use it, they feel comfortable and they feel relieved, honestly.
And well, you tell me, have you found anybody that grossly abuses it?
No. And honestly, let's say they make a mistake, oh, I didn't know this was just I just need a refill. Okay. And that has never happened at 2 o'clock in the morning. But let's say they call in the evening, and they'll apologize. Oh, I didn't know this was your emergency line. Like, hey, so we just have to give them information about it. They understand. And I don't think anybody has abused it from my standpoint, or even Dr. Lickerman's. And even if they made a mistake and called the emergency line and it wasn't an urgent matter, we just, hey, you felt it was urgent, so let's talk about it. This is why this would be an appropriate call or an inappropriate call. But no one abuses. We have not had that experience, and we're hoping that. But that's part of. We do an onboarding process where we call each patient before that first 2 hour, where we talk about emergencies and what should happen. And they're blown away by the fact that we call them before their first appointment too. And we give that information. I think what happens, we give them more information than not. And when patients have that information, they use it and they say, oh, I have access, so I don't have to abuse this. I know I can call her tomorrow and we can discuss whatever concerns I may have. And that availability is appreciated, and I think they like it so much. They're like, I don't want to lose this doctor, so I'm not going to abuse it. But
Well,
it does not happen.
and now let's put that into the context of an employer. An employer offers benefits to attract and retain good employees. That's the number one reason employers buy benefits. Imagine the ability to attract and retain employees by offering your employees this kind of health care. Once a person figures what this is and how wonderful it is, it's like, thank you, employer, for paying for me to have this level of health care. And now let's talk about how this level of health care can avoid so many medical errors. Johns Hopkins did a study where they found that the third largest cause of death in America was medical errors. Well, a lot of that comes from the fact that we don't have a primary care physician playing quarterback and coordinating all the care that goes between various specialists. Talk about the role of a direct primary care physician and how valuable it is to have somebody playing quarterback between the various specialists.
And I think quarterback is a good analogy for that, or a term to use, because we are behind the scenes. We're saying, hey, you have these medical conditions. You have three or four specialists. We don't want one specialist starting you on a medication that has side effect with another medication given to you by another specialist. So we try to make sure that we get all of the reports from all the consultants. And when we think there might be a conflict in medications or treatment plan, we can talk to them directly on behalf of the patient, or say, hey, you know what, how about we have all of the people that are involved in the care on a call together. It doesn't always happen that way because they're usually in fee for service, but we make sure that we coordinate their care. And so we say, hey, you know what, you're seeing a neurologist, but let's make sure the neurologist is aware, hey, this medication can be have a significant side effect with this other disease process that they may or may not have. And the patients appreciate that. And then sometimes the patient may tell us, I didn't understand the plan. And what we'll go through it and say, hey, you know what, usually we will request the consult note and say, let's make sure we understand the plan ourselves and go through it with them and say, this is how this is going to help you to get healthier. This is how this treatment will work. This is your prognosis. These are the kind of things. Sometimes having a trusted member of your healthcare team to go through it with you, almost like a second opinion. And we're not giving a second opinion, but going through it and going through everything that that's changed in the last few months or the last time they visited their specialist, and they appreciate that. They want someone to say, I'm in your corner and I'm going to make sure that this is the best plan of care for me and how this is going to keep me healthy. And so we're quarterbacking all of that care for them, and it's worked well. And then sometimes one specialist might want to repeat, let's say a CT or something like that. And we avoid repeating tests that don't need to be repeated. We avoid those things because, hey, did you know she just had one yesterday or 2 days ago? Oh, we didn't know that because it wasn't in the records that we have. No, she has one. We can send it to you. And if you need any other information, we can provide that for you. And that's another way we decrease costs, because we don't repeat tests that don't need to be repeated. And we also try to help navigate the things like radiology, where a CT can be $3,500 at a tertiary care center, but it may be $350 at a offsite facility. And we say, hey, we can make sure that we move you toward that place where it's $350 instead of $3,500, and that's going to lower the cost for everybody, the employee, the employer, and the healthcare system in general.
Right. And the traditional system is fee for service. And if you were working under the typical fee for service, you wouldn't get paid to do all that. And because you're not getting paid to do all that, it doesn't happen. And that's why medical errors kill so many people, is because we don't have a system built on someone playing the quarterback. The patient has to be the communicator, and the patient doesn't have the background and experience to be the coordinator and the communicator between all these different doctors. So having direct primary care helps the patient, helps the employer, and is much, much better for the entire healthcare system.
We think so.
So thank you so much. Let me just, I want to thank you, but I also want to just talk a few minutes at the end here about a conference we have coming up and the next webinar. So let me do that right now. Our next webinar will be in 2 weeks on Wednesday, June 2nd. We'll be discussing how holding patients' hands through major traumatic healthcare events not only improves outcomes, increases satisfaction, but can also save hundreds of thousands of dollars of healthcare costs. Lee Jacobson with Coba Health will be my guest panelist. Please join me on Wednesday, June 2nd at 10:30 a.m. Mountain Time. You can register through goingonoffense.com. I'm also pleased to announce that Orion is organizing a virtual aspirational healthcare conference this summer, July 14th and 15th, where we will be highlighting the NUCA system of care and other similar systems that have gone far beyond our traditional deficit-based healthcare system. Representatives from the NUCA system of care will be participating and sharing important insights that they have learned. If you are interested in learning more and registering, go to aspirationalhealthcare.com. As a listener of today's webinar, I would like to invite you to join the conference as my guest for free. You can use the promotional code that's on your screen, !Oriant, all capitalized, ORRIANT, $, and it will waive the registration fee. Again, that code is Oriant, !Oriant, and $. And you can register for the conference by going to aspirationalhealthcare.com. Again, Dr. Samuels, thank you so much for being with me today. It's been delightful, and good luck as you continue to do the right kind of smart healthcare.
Thank you.
Have a wonderful day.
You
Bye
too.
now.
Bye-bye.